And we have artists and members of IVLA, okay? So, the genesis of this whole project is that I was fortunate enough to grow up with a mother who was a docent, and I went to art museums with her and heard, guess what? What do you see? What's the first thing you see? What's the first color you see? Who would you be if you were in this painting? And when I started getting involved with Lourdes University College of Nursing, both as a master's student and later as a faculty, it occurred to me that, you know what, we're teaching nursing students to observe, interpret, describe, analyze. And I said, well, that's what the docents do. So let's get the experts to train our nursing students in visual literacy. So go ahead and begin. So this presentation is about a little bit about the program that we have with the museum on training, teaching our nursing students a new skill, visual literacy, and the research we did to see how do these nursing students process and connect this experience to elements of patient care. This is a quote from a student. Can everybody see all right back there? Okay. We all just looked at this and said, yes, this is what it's all about. So what you can expect from this is a review of our module and the research that we're doing. So why should we take students to the museum? Well, there's been a real emphasis in nursing education on graduating students who can think on their feet. And I don't want to preach to the choir here, but there's been great literature and research done about visual literacy. Visual literacy teaches people to communicate, to express themselves, to listen to others. And it's also a safe and nurturing environment in which our students can learn. So we want to educate students who can think on their feet, who will be able to express themselves, communicate, observe, describe. So we also know that involving a student in their learning helps them to understand it versus just standing in front of a room and giving a lecture or having them read a book. A little bit of the background, as I said, art analysis is nursing process. And in this structured art module, we have a docent give a group of students a tour, and then after that, their clinical instructor does a debriefing. I'm not going to take a real long time here, but there is an abundance of literature that does discuss how structured art observation can increase all these things. And the theoretical framework, of course, can anybody tell me what that squiggly line on the roadside represents? I mean, this is visual literacy, right? And this, of course, is Gardner's multimodal methods of learning. So one of the first things we did was several faculty went to the museum and Pat Tipton gave us a special tour to give us an idea of what the docents would be able to do. And this was a painting that we all just remembered so clearly. Some of you probably know this. This is John Lewis Crimmel's Country Tavern. And in this painting, we see a multitude of people enjoying, reading the news, enjoying a drink, getting together and meeting. So when you look at this, what do you see? Anybody? This is one of my favorites. We had several nursing faculty get stumped on this painting. I just want you to know. Yes.
I see a mother and her child coming to try and get the father out of the tavern.
Thank you. And that is what the artist intended us to see. Embarrassingly, several of us were looking around and saying, well, I see this, and we were looking all over the place. And God bless her, Pat Tipton kept saying, and what else do you see? And what else do you see? Now, granted, it's a very small painting, and we were sort of at a distance. And then finally, through this wonderful docent intervention, we were led to see, aha moment. this painting is really about the moral story at the center of the painting. This, in other words, the mother and the child pleading with the father to stop drinking. So this struck a real chord with us because we realized that our students could have an aha moment. We realized how addiction hides in plain sight in our society, just as it did in this painting. And when I did take a group of students through, one of them said that. They said, the only reason I noticed this was because of the lighter area around it. And she said, addictions hide. They hide everywhere. And that is something, that is the kind of connection that we want students to take from this tour. So after doing this for a few semesters with our students, somehow we decided, you know what, we need to do a research study because there is not a lot of information out there that tells how do nursing students connect this experience. More and more people are taking students to the museum, but how exactly, you know, what goes on in their minds? How do they know this? So the research question is, how do first-year nursing students who participate in this program connect this experience to patient care? And I'm going to give this over to Liz, who's
need a little bit more light.
she is going to just go through some of the methodology.
A little bit more light, if that's possible. Oh, no. Okay, perfect, all right. Yeah, so our research question wanted to know if the students could connect what they were seeing here at the Art Museum to CUSIN concepts. And what CUSIN is quality and safety in educating nurses. And that's the framework that we built our curriculum around. And there are like 6 competencies that go along with that. Some is patient-centered care, safety, teamwork and collaboration, and I mean, they're all covered with the artworks that are here in the museum. So we wanted to see if the students could connect those. So we decided to do a qualitative research study. The sample we used were 2 cohorts from spring and fall of 2013. And these students are in their first semester of nursing. So it's just like, you know, they think they know how to observe something, but they really don't. And so that's a very interesting part of it to me after they do the structured art experience. One of the cohorts did have LPNs in it, but you can see there was a total of 110 in the 2 cohorts. More females, of course, nursing students than males. Our basic students are our pre-licensure students. That means they have no other nursing license, etc. They might have another degree, but the LPNs do have an LPN license, and therefore they do have some experience in clinical. So they might be a little bit different in observation than the basic students. So we did have, we used grounded theory, we used guided reflections, and Lisa made this all up. And as I want to just say, I was sitting in my office one day, and this woman came in and introduced herself, and would I be your preceptor? And it was Lisa, and it was like, wow. I didn't realize what I was in for when she showed up. And I agreed to it, but it's been great. And she had an idea, you know, about coming to the art museum that it's just been wonderful. So that we used guided reflections. The students were to come here with a structured art tour with a docent. We told the docent what our goals were, and then they picked out the artwork. We didn't pick out the artwork until, of course, I had gone a few times and said, you know, I really love this I really love the tavern painting because I see that as vulnerable populations in addition to addictions. And so we talk about that in community health. So the students have to complete that guided reflection within a week. So they have a week to reflect on what they've seen, etc., and observed. And then we had focus groups that occurred a few weeks after that. and Lynne Zajac conducted those. That's okay. So on the guided reflections, one of the questions was examining things such, how did examining artwork help a student understand more about a particular nursing concept? And so they had to do community health in this first nursing semester, and then vulnerable populations was a concept, or health promotion, or patient safety. So the Structured Art Museum, I talked about the guided reflections. We had 56 of those 110 students agree to do this. It had to go through our Lourdes University IRB. Focus groups each contained 3 to 6 students, and we had 15 students participate in them. And then the big part was the interpretation of the data. And for our grounded theory approach, we did use Strauss's 3-step phase of coding. And I learned a lot in this process, but you have to interconnect categories, build a story, come up with a theory. And so I'm more of a visual learner, jeez, and I find myself here. And so Lisa made this up for me so that I could understand things a little bit better about the whole process, even though I was in the middle of a lot of it. So for our data, we did use 2 cohorts of students. And so we did the data collection, didn't happen all at once, but as soon as we finished one cohort, we started our line-by-line analysis. And what we did is had the reflections printed out of the students who agreed to be in the study. And we each sat individually, I was at home in my chair, and just circle what sounded important. So it was a very low-tech kind of way to do it. Apparently now you can do it on computer, but we did it the low-tech way, the way I understand how to do it. But we went line by line through those 56 guided reflections. And then when the focus groups were typed and printed out, we went line by line through those. Then we did the open coding, which is labeling concepts and starting to develop categories, and we did that as a group. So we went through each of those, again, those reflections, and discussed them as a group, and what did we see as important, and what I might have found important, maybe Lynne or Judy or Lisa didn't, and so we discussed that, or maybe they found something that they felt was important that I hadn't circled or whatever. So it was a great discussion to start having. The constant comparison, we were always going back and looking and seeing what the data was saying, and then of course after when we got to the second cohort, we were going back and looking at what the first cohort had to say, and were there any differences and additional information? Did they fit in? Can you go back for me? There you go, thanks. I better keep my hands away from that. And so then we did the axial coding, which is identifying relationships with all these categories that we had found. The theoretical sampling is just deciding what data to collect and to help develop the theory. So had we gotten enough, did we get enough data to say we were saturated and we weren't coming up with any new ideas to add to our theory? And then, so this kind of goes around in a circle, but then comes over here to the selective coding where you integrate and define your theory, and then have your theory, which towards the end, Judy and Lynne will go over, but I'm going to hand the findings back to Lisa.
So that was the methodology, and now comes the fun part. I mean, it's something we have to do, just to let you know, we didn't just grab ideas out of thin air. This was an exhaustive process.
We did do it very systematically.
So we started taking students to the galleries, and these are some of the comments that they made about these paintings. And the docents here probably know this is Rubens, the
Crowning of St.
big,
Catherine.
beautiful, wall-sized crowning of St. Catherine. And students approach this and they see, oh, swirling pretty colors and, all these voluptuous women, and isn't it beautiful? But then we start to say to them, okay, look closer again. And we bring them in. I'm supposed to be able to do this. Okay, never mind. So we bring them in closer and closer, and then the docent has them go back and forth, and she has them look at this painting from a different perspective. And then the docent starts to tell them the story. And the students get the idea that, boy, you really need to know the history, the culture, and the context. And they relate this to how somebody really needs to know about the patient. And one of the students related this to, in her clinical experience, noticing a photo on the patient's nightstand. And this enabled her to establish a bond with that client and hopefully get more information, more and more information. We want to produce students that, of course, are scientifically prepared, and we certainly have a lot of scientific content, but then we want to produce students who will get to know the client. We want to produce that student who will pick up on something that is unsaid and will establish that bond with his or her patient. So this was a wonderful example, and the students definitely responded a little bit more, we noticed, to the representational works. This, of course, is Barbieri's rendition of Lot and his daughters, and it was wonderful to take the students through this gallery so that they could see this story. And again, we talked about who has the power in this shifting narrative, and they talked, and their response was, well, the daughters do, because, right, they get Lot drunk, so that they can further civilization. And one of the concepts we apply to this, of course, is people do what they need to do to carry on, and we need to respect our client for the decisions they make about their health care and work with them. And of course, a student had an aha moment, because Lot's wife, despite an angel of God saying don't turn around, turned around and turned into a pillar of salt. And her aha moment was, this is what my patient does about bacon and his low salt diet. Right? And so the students start to realize you have to work with the client. You can't just say, do this and this. Oh, sure can.
And so that's what the students said about the bacon and the diet when the wife turned to the pillar of salt. This is when I had my aha moment too. And it wasn't the first time I had been through, but it was like literally, I can get very excited, started jumping up and down going, I get it now. And it was health promotion, because the mother decided to look back, they decided not to. So why do some people continue smoking? Why do some people not? Why do some people eat bacon, all the time, and some people eat a better diet? So yeah, I was very excited in that. And then I felt that I could really embrace this program.
And one of the really wonderful things that a docent said to a group of students said, we don't have power, we're nursing students. Because one of the things the docents do is talk about power and vulnerability. And the docent said, anybody in a hospital with a badge has a position of power. And I just loved her. She wasn't a nurse, but she's been there. So, and of course, the Artemisia Gentileschi interpretation of Lot and his daughters, which is from a very different point of view, where the father is soused and looks like he's trying to seduce the daughter versus the other way. And of course, we had students write very beautifully about how you really need to consider your patient, and different people experience things different ways. And then a very popular painting with one of my favorite quotes, the painting Alex taught me, there is more to a person than what meets the eye. First impressions shouldn't define our clients. And then she goes on to talk about how as you step closer, the features that define Alex's face become blurred and a grid of colorful cells becomes clearer. Not everything is as it seems. This particular student then went back to her clinical experience and got to know a man that had put her off because of his grumpy face. And so, I mean, we have 57 reflections, 56 reflections that are just rich with meaning that students took from this experience. A lot of students were very attracted to this one because you stand far away and you get closer and closer and you realize the artist, Julian Schnabel, has painted on, you know, broken crockery. And a lot of people took away from this one, you get closer to the person and you see them as a person versus their disability. And we do a lot with that. And this is the final slide. And I wondered how students would react to an abstract painting. And you know, what we got were these wonderful, rich interpretations of the black representing the mystery that the patient is and how you have to peel away the layers to get to the color underneath. You know, so much more meaning to it than meets the eye. And this is so important when they are out there working in the community, working in the hospital, because they have to be acute observers. We're expecting them, they need to tell when their cardiac patient is going downhill. You know, and there are many ways they tell that. They need to know if a client in an interview situation might be a victim of abuse, and you need to get them alone for that interview. I mean, there are so many wonderful ways we can apply the skill of visual literacy to our practice. And now, Lynne Zajac ran the focus groups, and Judy Didion, and Judy Didion is very well versed in grounded theory, and she and Lynne are going to present our theoretical model of how these students make these connections.
Thank you, Lisa. I'm going to start, and then Lynne's going to talk a little bit more about the detail of the constructs. But I just want to say, first of all, thank you for allowing us to come to the museum, those of you that are docents, and welcoming us and our students. When Lisa first came to me about the idea and we talked about it, you know, we have only so much time in our clinical learning. And what we try to do is teach our students very complex concepts in a short period of time, 5 semesters. They have prerequisites for 3, but then their nursing majors, 5 semesters. So how do you help these students who may be 18 years old, moving through college with little life experience, understand some of these very complex concepts such as empathy, diversity, culture, critical thinking, and what we call is patient-centered care, which is one of our major outcomes we hope to achieve with our students, where they finally look at the person and involve them in that care. So involving a person in their own care means you have to talk to them, listen to them, ask questions, not make judgments off the bat. And then opening up their eyes to different perspectives and looking at the holistic approach to nursing care. So when we analyzed our data, these were the concepts in the middle that kept emerging from the reflections and the focus groups. So we were very happy because it aligns with our curriculum, and there were others, so this is not exhaustive, but these were the major concepts that came out. But with grounded theory, what we're really looking at is the process. So the process of using a visual work of art to teach students about nursing. How does that happen? What are some of the variables that might increase or decrease that learning? And then, you know, how well are the students learning what they need to learn to enter into practice? So when we analyzed the data, we came up with this theoretical model. And really, this is a theory. It's what we see from the data, how this learning affected the students, how this process affected the students. And it was really based on the 3 variables in this circle. So Lynne's going to talk a little bit more in detail about these. But what we saw is that the analysis process itself, and then the cultural context within which that student lived, and then their experience because some of these were first level students, some of these were LPNs returning for a baccalaureate degree, so they had a different perspective. How these three concepts made a difference into the amount of learning that took place in the center. So this model that we came up with, we hope to be able to test down the road, because you could probably understand how, if any of these variables change, it could affect the learning process. And I have to say, you know, reflecting back on what Liz and Lisa said, you know, what we were able to do with this experience that you can't do without multiple interactions with patients in the setting and having multiple debriefing moments with those students, working with those patients over time, is that they were able to pick up immediately how their worldview impacts their ability to interpret the story of what that artist was trying to portray. And they picked up this idea that this is what happens every time they interact with a human being in the clinical setting. And I had this conversation the other night at the dinner that was took place here with someone who was in the restaurant business, and he said to me, wow, I should have the same kind of experience with my waiters. I mean, it really is, how do you interpret, how do you help someone learn the fact that when someone says yes, they might mean no. So it's helping that student learn about the details, picking up the details. And it's so easy in healthcare for us to ignore that, because when we start looking at the details, it's more work. And I don't know if any of you have experienced, I hope not, but what most of us have, either through friends or family or ourselves, what the healthcare system can be like. So this is our intent, is to change that. And this process was one way that we saw that we could make a difference with that. So I'm going to let Lynne come up and talk about these individual concepts.
So I had the privilege of leading the focus groups, which was wonderful. I teach in the graduate program, so I didn't know the students, and that's really important for the focus group facilitator to have, you know, an objective perspective. And I was really curious to see how they would respond to the questions because they were first year, first semester. The reflection piece, the writing, they did right after the art experience. The focus groups took place about 3 months after that initial experience. So the questions in the focus group were were broad and related to the experience itself. So we wanted to find out, okay, now that some time had passed, what did they think about that art experience? And did that art experience, has that influenced any of the care that they've given in their clinical settings? So when we looked at the data and we looked at these three constructs here, we realized how influential these three areas could be in how in-depth their responses were in the focus groups and in their reflective writing. So for example, cultural context. We have students, some students that are 20 years old and students that are 40 years old. So obviously that's going to be a huge difference in how they look at the art and how they make the connection to patient care. So in those focus groups, you can imagine the students that were older with more life experience were able to articulate a little deeper about how the experience influenced their care. Also, our nursing student population is about 20% diverse. So we have a mix of students. And again, diversity plays a huge part in terms of their exposure to other cultures or their own personal ethnicity, influenced how they looked at the art and how meaningful the experience was to them. With the patient care experience, and Judy mentioned this, that we had the LPNs who have a current practice versus our brand new students who all they had was the 3 months of clinical. So again, that's going to influence how they responded, how they were influenced by the experience, and how that influenced their care. In terms of the art analysis process, the students, what we found we had different groups of students that came to the art museum, and they were led by different clinical instructors. And what we learned through the process is that we probably were not consistent enough with our different instructors about the meaning of the experience. So the instructors that valued the art museum experience were able to present it in a way to, generate excitement and, anticipate this learning experience and take from it what you can get, versus other instructors who might not have seen the value and, they came and they participated. So the way the instructor presented the experience and the way the instructor debriefed after the experience also, I think, had an influence on the student, because the ones that had a more, exciting pre-experience and debriefing felt stronger about the experience and how they were able to connect it to nursing care than the students who, they said they were disappointed. They felt that, they weren't quite sure about the experience, and, they would like to try it again to see if maybe they could garner more meaning out of it. So, for us, it's been interesting to look at this because, as you know, it's not just about going and looking at the art. It is, what takes place before the experience itself and how it's presented to the students. They recognize that they jump to conclusions and have some preconceived ideas when they first view the art, and they talked about how meaningful it was to have the docent provide the story behind the art. I think that was just so key to them because they talked about no longer making assumptions, or what you see isn't always what's really going on. The other piece of this process is I was able to work with a graduate student who did her capstone and she, around this art project, and she specifically looked at the LPN students. And even the LPN students with the, they have some practice experience, all reflected on kind of peeling back the layers and what's really going on with that patient, the same way that, we look at art and approach an art piece. So anyway, where I was going with this is, as instructors, we have a better understanding now, I think, of how all three of these areas are going to influence the experience for the students and how we can make it more meaningful for them. And then when we take it one step further and think about, okay, now we have this model, where do we go from here? So the next step really in the research phase would be to look at these three areas and maybe change the variables a little bit, and indeed see, does it matter if you have two students and they're each from a different culture? Does it matter, does their culture matter in how they view the art and how they connect that back to their patient care? So we have some research. We have some research questions, I think, too.
And I was just going to add one other piece is, as educators, we look at this from a curricular standpoint. What if we move this visual experience to a later point of the curriculum, or have an additional experience at a different point of the curriculum where they've had more patient care experience? And I know Lisa's already starting to standardize some of the debriefing curriculum, so that every instructor, we have our docents that do a wonderful job, and they're very standardized in their approach. But it's the nursing faculty that we have to have some standard questions that each of those faculty members pose to connect the dots afterwards to make a difference with this experience. And then, of course, if we could have, we don't always have that opportunity to diversify our student body so that we have different ideas, but it might make a difference. Even if we had graduate students and undergrads mixed, something that would, so that the group discussion is richer. But as far as recommendations for future research, what we plan to do.
We had three areas, three questions.
Do you need a flashlight?
I think I can read it. Does the incorporation of visual literacy in nursing education impact the quality of care? we would really love to have some data to see, okay, we know this in theory, but is it gonna change patient outcomes down the road? And that's really what it's all about. That's why we're educating our nursing students, so that they have a positive impact on patient care, patient outcomes. The second research question is, does the incorporation of visual literacy in nursing education impact nurse-client communication? I mean, that, communication is a big part of what nurses do. So, depending on the individual, you communicate different ways. And I think, we think that the art museum experience helps them to see that. It individualizes that nurse-patient experience and relationship, and the communication needs to be adapted to the person. And then, does the incorporation of visual literacy in nursing education impact nursing care for the patients of diverse cultures? And that's that diversity piece again, that, as nurses, we don't treat everybody, the same way. We need to learn how to step in the other's world and view the world through their lens so that we can provide the care that they need, not the care that we think they need, but the care that they need based on their culture. So those are three big areas we'd like to look at in the future. Lisa?
I wanted to add, there were some unexpected findings that fit in with what Judy and Lynn were saying, which is some of our students had never been to a museum. A couple of students lived within a stone's throw of this museum and had never been to it, had never been to an art museum. And we want to produce, we want to help people learn to appreciate the arts, because we often talk about the art of nursing. And we like to think that we can incorporate some aesthetics into this incredibly scientific, content-laden curriculum that we give to them. And I want to see Lourdes student be the one who at 2 in the morning goes and gets a comfortable chair for her client. I mean, to insert an IV and to observe skin tone and texture and know when that person needs more oxygen, all those things. But I also want them to look at the person as an individual and think of, okay, if this were a painting, what would I be doing for this painting? And of course, a big part of it is communicating, listening to others, and not being afraid to call a physician or a pharmacist in the middle of the night because they see something going on that shouldn't be going on. And that was a finding that we are hoping to see when we interview these same students next year.
Yes, we have some time for questions.
Yeah.
Anyone has any questions?
I see a hand.
So this program, I have many questions. So this was a sort of a one-time visit to the art museum where they did a tour of the docent and then you had follow-up reflections.
Well, it started as a one-time pilot project, and we were just overwhelmed by what the students took away from it. So we made it part of our curriculum, and now it is a permanent part of our curriculum that these nursing students will come to the museum. They will have a docent-led tour. They will learn the skill of visual literacy because we've seen how it helps.
But
And it is
only
the
one time.
one.
It's just once for the students.
Okay, yeah.
Oh,
so-
sorry.
Oh, no, that's fine.
Yeah,
So the students come one time, they do their reflections and that kind of thing.
But it's not the last time they come to the museum.
Mhm.
It opens their eyes to what the museum can do for them.
Well, I'm just curious, was this incorporated in another course, or how, being students, they have to get grades? Were they graded on this project?
Yes, it was part of there. We have, in the first semester of the program, we have 3 theory classes and 1 clinical class. And we put the art museum experience in the clinical portion. So we spend a few hours here and then talking about it.
And they're graded on the
Yes,
reflection.
they're
Right.
graded on the
They have
reflection.
there's a rubric. They have to address certain things. It's not necessarily what they say, but they have to demonstrate that they're thinking about it.
How much information were the students given before their visit about what was expected or what the goal of the visit was?
Well, they had the guided reflection questions in their syllabus. And they kept asking, you know, why are we going to the art museum? Why are we going to the art museum? And I would explain it and I'd still get, why are we going to the art museum? And finally I just said, you have to have faith in me. Why we're going to the art museum? Just have faith.
I posted a PowerPoint
Right.
online for them, and I think maybe half a person looked at it. I don't know if I remember, right? So now, we've learned from that. And Robin Ham and I teach mental health, and we are having these students do what I think of as image speak. They are looking at art from this collection, they're taking photos, and they're writing a reflective essay. These students will be here in 2 weeks, and they'll know all about what this tour is going to be about, and they can't wait.
You did not have very many men, but did you, in that little sample, did you notice any differences between the men and the women?
And I don't know, we didn't pair up, when we got when we received the reflections, they actually went to an administrative assistant, and she took names off of them, but paired up to who signed a consent, so we don't really know, male, female.
Yeah, it would be, it was all very anonymous, but there might be a way.
Could be.
IRB.
Yeah.
I think what you said about the attitude of the instructor is hugely important. We see that, I work in an art museum and we try to do language programs, and we definitely see the same thing happening, is if the instructor really buys into it, it happens, it really happens. Now, so what advice do you have for us in terms of who we contact? I mean, you started with somebody in the nursing program who was excited about doing this, right, by the idea. So how do we hit it from the art museum angle? I mean, just find the right person?
Oh, first of all, give me your email,
Okay,
and I'll send you this and some of the literature that supports
right,
that this can increase higher order thinking.
right,
We do
I
have-
really tried
we
to
do
take
have some
notes of the
literature.
That was a question, if we could have your PowerPoint.
And I will be glad to send that to
We
you.
actually met with Brian Kennedy before we started this. The other thing we did is we brought all of our faculty here, and they had an experience with the docent, we went to lunch. So that, we have attrition, so we haven't kept up with all of that, but I think that helped them to imagine how this will work in the curriculum. So I think that's important, that those that are involved in this process have their own experience first, because that's where you start to think, and we've even brought master's students here because we talk about theory and concepts, and what better way to teach them than to have them look at a painting, which is a concept. So, but it's a different language than we're used to in healthcare, right? So we had that little bit of time for development, and I think that helped the attitudes.
Right.
a little bit.
We have a lot of
For me-
part-time instructors too
Right.
that
That's the
teach
problem.
clinical, and sometimes they don't get all the consistent information, and so we're working towards that.
To include that in their action.
And for me as permanent faculty, I think it took 3 trips here. And I started jumping up and down, going, I was behind it, and I was selling it, but it was still not really.
It was that pillar of salt.
That's what did it. That's what did it.
I just have a comment. I went through nursing in the 70s and the 80s, and all about observation and looking, but nobody told us that. So you learned as you went on. What I really think this is going to do is give the nurses in practice confidence, and what you said about standing up to the medical staff and saying, I believe this is what's happening, and then them listening, because
Yeah, and standing up to your head nurse, standing up to your charge nurse, standing up to your colleagues. I didn't mean to just focus on the medical staff, but standing up to anybody.
so I wish I had.
Maybe you could help us get the medical student, we'd like to do an interdisciplinary.
Right.
Perfect.
That would be good.
Yes.
I just had a comment. As I am a nurse practitioner, and I think this is wonderful. This is a wonderful project. because the values such as empathy and compassion, they cannot be defined. You have to experience that. And the fact that the faculty at Lourdes is behind something like this stresses the importance of those values as outcomes for the graduate. So this is a great partnering with the illustration of what does empathy mean, what does it mean for an African American versus Hispanic, and it allows that to be discussed. And it shows the emphasis of what outcomes you would like to see. So that is a great
I
project.
can't say enough about the fact that we have a world-class museum and an expert in visual literacy taking our students on these tours. We're very lucky.
Wonderful.
Just a comment essentially the same. I too am in a profession that's labeled an art and a science, but I don't remember ever having anyone talk to me about the art. You know, as I've trained students, that comes in, but never in this way. This is just really outstanding. And you know, they're afraid of the art side of, you know, because science, and it can't, I mean, science is important for heaven's sakes, but they tend to be afraid of looking at it from the art side where there is not all that structure and it's not black and white and right and wrong. So this is just fantastic.
Yeah, and it allows the student to be able to trust what they see. And if they can trust what they see at the museum, they can trust what they see at the bedside, which then gives them the confidence to, you know, speak to the people that they need to speak to. Because they're, you know, doctors are on this pedestal and you're afraid, you know. So it gives them that confidence to believe what they see.
And you know what? Sometimes the scariest people in the hospital are the people that bring the meal trays up. You know? And we're in the position of saying, you know, I know my client didn't order this, and oh boy, you know, I want our students to persevere and get that right tray.
So I teach a 7-week elective to med students, the MSc med students up in Michigan. And one of the things that I found has been really helpful, what I heard from my students that they needed, and I'm sort of translating this to nursing students as well, was in school you get a lot of theory on things like conversation, dealing with ambiguity, and observation, but not the practical skills. So it sounds like you guys work really closely with the TMA docents, and something that I use in my classes, I actually give my med students the docent curriculum, because docents are fantastic question askers and listeners. And so if you sort of pair up with the docents in that way too, because like I said, docents spend a lot of time crafting beautiful questions, and most of the time in the medical profession, it's not necessarily about how you're asking or something, it's what you're asking. You have to know what questions to ask, and docents are really phenomenal at asking those questions. Just as they were asking questions, you know, to zero in on the center of that story, docents think through that a lot. So that could really bring it to another level for your students too. So I encourage you to take advantage of the docents, not just on their tours, but if there's time at the end to sort of ask them through some of those process questions, I think that your students could really benefit a lot from that. So things like how to craft questions, what is an observational question, an evaluative question, an analytical question, because like you said, your students are doing that already, and docents are really keyed into that. So they can be really helpful in that way too.
Thank you very much.
Thank you very much.
Thank you. And we finished on time.
You teach medical students at UNM, at MSU actually, the other Michigan.